Okay. Hello. So the doctor has ordered a blood transfusion to be administered to my patient. So I'm just going to recheck my orders and then check the facility policy. And then now I will gather my supplies, which includes equipment for measuring vital signs, the Y-shaped tubing, and the 250 milliliter bag of normal saline. And then now I will prepare for the transfusion. So I am going to knock knock. Hello. I'm your nurse Mindy, and today we will be administering a blood transfusion to help with your anemia. Okay, and then can you just verify your name and date of birth for me, please? Okay, thank you. Now for hand hygiene and don gloves.
Here is your PCD. You are being issued two.
Okay. Now I will perform vital signs on my patients to gain baseline vital signs, and then I will ensure that there is a 20 gauge IV access or larger. And then now I will prime my IV tubing. So first I will get my saline bag. I will ensure that this is clamped first, and then I will spike my bag and hang it up. And then I will unclamp the tubing, and then I will unclamp this tube and make sure that the whole line is primed and that there are no air bubbles.
Each time you come on, you're going to give you a new one.
And then I will clamp the tubing again. And then I will fill the drip chamber so that it covers the filter. And then now I'm ready to go retrieve my black bag. So I will, when I leave the patient's room, I need to remove my gloves. Remove my gloves.
Oh no, everybody has to use their own.
I need to remove my gloves. This is just for demonstration. Remove my gloves and perform hand hygiene. And now I will go to the blood bank, retrieve my blood, but first I need to identify it with another person there and check that everything matches. So we need the patient's name, birth date, medical record number, the unit number on the bag, the expiration date, blood type, and the blood product type. Okay? And then after we've done that, I will take the bag to my patient. And then once I enter the room, again I need to perform hand hygiene and don gloves.
So, are they going to have that set up already at the school? I don't know because I don't recall.
And then at the bedside, we're going to need to verify that all the information matches the patient again. So we are going to need to verify the patient's name, birth date, medical record number, once again match the unit number, the expiration date, blood type, and blood product type. Okay? And then now we are going to connect the IV tubing to the patient, maintaining sterility, cleaning the ports if needed, and then attach the saline tubing to the patient. And then we can clamp the saline tubing, make sure that it's clamped, and then now we are going to get our blood bag and spike the blood bag and hang it up. And then we unclamp it, and then we are going to set the infusion rate for um, a slow rate, for example, like 5 milliliters per minute or whatever is ordered for the first 15 minutes to monitor the patient's reaction. And then after we start infusing, it's good to tell the patient to be aware of any signs of an infusion reaction, such as dizziness, nausea, lower back pain, flank pain, or any other signs such as like fever that could indicate an infusion reaction. And then we are going to monitor the patient every 15 to 30 minutes to see how they're going to take the reaction. And after the first 15 minutes, you need to take the patient's vital signs. And then afterwards, every 15 to 30 minutes, you need to monitor the patient again to see how they are taking the transfusion. And then the whole transfusion needs to be finished within 4 hours of receipt from the blood bank. And then after that is finished, then we can remove our gloves, and then perform hand hygiene, discard the supplies, and then leave the patient safe and comfortable. And then we will document that a blood transfusion was administered and how the patient received it, and also the units of the bag.